we've been part of a project that's focused on preventing the risk of injury and suicide in Michigan men, or PRISM. And part of that work has allowed us to develop a toolkit for telehealth practice for providers who are, and clinicians who are working with men to support their mental health needs in our state. And so this toolkit came together over the course of our project, and it was developed by a panel of experts that included psychologists, psychiatrists, community mental health professionals, directors of behavioral health for hospital systems, and they worked on pulling together an open source resource hub for mental health services and resources to support providers in practice, and to pull together resources that could be easily accessed across a full continuum of suicide care. We intentionally incorporated and included strategies and resources for behavioral health providers that are working with men in their practice. And over the last several years, we're seeing so much of the behavioral health practice shifting to telehealth modalities. And we also have seen and are responding to trends with men in their help-seeking behaviors, about their comfort levels and their typical concerns with sharing their mental health status and seeking help from providers. And so we took these in developing the toolkit, and we arranged for each of our prevention strategies and intervention strategies some unique resources that providers may want to seek out as they reflect on how best to serve men via telehealth. And I'll give you a few examples. For instance, the toolkit includes video simulations of behavioral health practice providers working with men to develop safety plans and to de-escalate a current crisis that is underway over telehealth, which has very unique considerations. When you think about a client that you're helping to develop a safety plan with, and they're in another setting where there may or may not be lethal means nearby, there may or may not be other helpful support resources and people nearby. How do you take all that in as a provider in practice and make sure you're accommodating for that via telehealth? And so that's just one of the examples. There's several simulations that we've included, and we will probably be continuing to add these to our resource, this hub, as on demand.
There are also many training and resources links to help you gain further understanding and preparedness with access to means, prevention, and post-prevention. And you will find a section on men's specific needs where we spotlight man therapy.
And man therapy offers this wonderful bridge to not only be part of a provider's practice, but is much broadly a great resource for teams that providers are working within, whether it's the provider themselves, or if it's part of their collaborative care team, or if it's their outreach, their case management. All of these contacts and touch points with men and men's family is a great opportunity for sharing and raising awareness about the great resources that are available within the Man Therapy open source site as well. I see this as a great opportunity to include in care cards that we know providers are sharing, both before and after, and as follow-up to some of their consultations. I also increasingly see the engagement with social services providers in our communities that extend well beyond the provider in practice, but really are very important touch points for men to begin to become aware of man therapy as a resource that they can go to, and also oftentimes across this network, there are many trusted individuals that men are comfortable with in taking this suggestion in. So we actively share man therapy, not only with providers, and it's part of our toolkit, but we also make sure that everywhere we go, where we're connecting across the network of social services, that our partners in community-based organizations are aware of this great resource every time that we can share that.
We invite you to visit the website for more information and to access the PRISM online course at med.cmich.edu/PRISM Toolkit. Thank you for your support and your collaborative efforts in reducing suicides in our Michigan men.